this morning I am so excited. I don't know that I've ever been excited over any guest speaker like I am today, to be honest. Because, you know, like you're thinking, how can I meet the president of Johns Hopkins University Hospital? And then the doctor is looking for you. He's looking for you and doesn't even know he's looking for you. So there's this hospital one beautiful cancer treatment hospital in Lagos. And I've heard about it. I've sent somebody there. Somebody introduced me to the place, and I've looked them up on the internet and all. They treat the cancer like they do in America, very professionally. There are no guesswork and all. And I'm like, you know the thing you don't even expect. You just like the thing, but it looks so far away. And then we sent one of our daughters there for treatment, and something was not going right. I said to her, tell them you are not happy with this doctor. They should give you somebody to tell you exactly what is happening to your body and all. And put 1 and 2 together, it reached the madam of the hospital. And she's like, they changed the doctor and blah, 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 you know. And, okay, so I'm so happy my brain is jumping. Thank you, Lord. So Hansatu calls me and says, I know the owner of the hospital. And like, I spoke with her. She actually has a program in Abuja. And if you are able to, she said, if you are able to gather a few women, she'll be glad to talk. I said, few women. I was so excited. Then we connected. I said, you know what? I always have a slot on Sunday to preach. I'll give you my slot. Because if I call a few women, you will not come. So today, every woman in Family Worship Center is here today. And she's going to speak to us about cancer. I'm tired of cancer. You just be sitting here, that one has cancer, that one has cancer, that one. I'm like, what is this cancer? So I said, come and speak to us on cancer, how to detect it, how to prevent it, and all of that. And I'm so excited. I told her yesterday, you know, now I know how Elizabeth felt when they said Jesus had come. I feel so much joy that we have an opportunity for men to hear about prostate cancer, so that we just know let's fight this thing. It's not just prayer. Knowledge is good for prayer. Even knowledge is good for prayer. So I am so excited today to bring forward the CEO, the owner of Marcelle Ruth Cancer Treatment Center, Dr. Modupe Odunsi. Please come forward. Stand up and give her a rounding, sounding, wonderful applause. Clap your hands. Come. She's a Christian. Hold her. You don't want to be held? Okay. You're welcome. I'm so happy you came.
Good morning.
Please clap your hand better than that. You will encourage her. You will let her know we are happy to have her. Just relax. We are an easy church. We are not this proper Lagos, pretend. Everything has to be nice. As you can see, my hair is about to fall. I can actually remove it. We don't. Take my shoes off. You can take your shoes. In fact, you can take your wig off when you are tired. This is our church. Please speak to us. I want us to. I know that you have a business to run, yes, but I want our people not to come to your hospital. But if they have to come, if they have to come, let them come to the best place. So educate us and help us. Are you happy she's here? Yeah. Clap your hands and be seated. Yeah. It's all yours. Media people, please don't frustrate her, encourage her. Make sure you move her slides. Thank you.
Wow. Good morning, church. Good morning, good morning. And first of all, she says she's very excited that I'm here. I'm more than excited to be here. But she's told the story already, and my story is a story of God moving before me. And I just wanted to say quickly, first of all, thank you so much, Pastor Sarah. I know your name, Pastor Sarah. I'm a bit overwhelmed, to be honest. Thank you so much, and thank you to all the church and for the welcome this morning. I really am so honored to be here amongst you. But before I start, I want you to just say a very quick prayer with me. Thank you, Lord, this morning. Thank you You know, I come to you with huge gratitude for this opportunity, which I know has only come through you and with you. Let me be your vessel this morning. Let everything I speak be of you. Help me to teach and to encourage. And let all my words today be the seed for the growth and the improvement for every cancer patient in Nigeria today and beyond. Thank you. In Jesus' name I pray. Thank you. Thank you. So I just want to say very quickly, for those of you, first of all, I don't know whether I'm going to move to Abuja, because I've got to be a member of this church. 7 o'clock in the morning, on a Sunday morning, 7 a.m., look at the women in this church. Me, when I dress like this is my bottom box. Do you understand? To go to the biggest party, this is how you people turn up on Sunday morning, 7 a.m. in Abuja. Ah, no, I beg, I'm coming to Abuja. I'm coming here. And the dance, there was a lady, I thought she was like in the gym, right? Honestly, how to honor God first thing in the morning. You know, that lesson, honoring God. But that's not why I'm here this morning. My job this morning, and for those of you who want to fall asleep, you can look at the first slide and then, you know, nod off. My job this morning is to let everybody know that, yes, we have to change this word cancer in our minds. Cancer does not mean, oh, somebody's done something wrong, they've inherited something from somebody, they caught something from somebody. Cancer is nothing to be ashamed of. Cancer is an illness. It's one of the silent killers, like hypertension, like diabetes. But if you say to somebody, I'm hypertensive, I'm diabetic, they're not going to shrink into themselves, right? Are they? They're not going to behave like, oh my gosh, you've got cancer. Yes, it's, you know, and the reason why we have to change our attitude towards cancer, the two things, myths I want to dispel this morning. Cancer is treatable. Cancer is curable. You heard it from me. Cancer is curable. And it's the same God who has created the doctors, the opportunities, the machines, everything, and the drugs that we have to treat people. Okay? So please, let us remove that stigma. And it's important that we remove this stigma. Because when next time you have a friend, a colleague, a sister, or brother, your job is to what? To encourage them and to stand by them, to ensure that they go and receive the treatment that they need to receive on time. Because cancer is only curable if what? We present early and if we receive the treatment early. Once the cancer has spread, and the reason why most of us in this room have a bad impression about cancer is that the majority of people that we know present late. Because people are afraid. When they see something wrong, they don't go to the hospital. And even if they go to the hospital and they tell them to do this, do that, guess what? They go away, they go to the herbal medicine person. Sometimes they go to church and so on, which is all fine. But my message this morning is that there is no stigma about cancer. And I love your theme, what eyes have not seen and what ears have not heard. But think about it. Cancer, one of the biggest risks of cancer is age. The older you are on this planet, the more likely you are to get cancer. And it's not about who you are. If you think about King Charles of England, who spent 70-something years waiting to become the king of England, he's probably going to be the shortest king, sorry. What has he got? Cancer. He's the king of England. What has he done wrong to anybody? So think about it like that. Or think about the 20-month-old baby that we admitted at Marcelle Ruth this week. Yes, cancer occurs in children. What have they done wrong? What have they done wrong? It's an illness, it's a condition. Cancer is essentially the cells in our body. The next slide, please. The cells in our body, for some reason, and just move across to the next slide, decide to stop growing in the way, the pale brown on both sides of the slide, is the way your cells divide every day. And our cells divide. Our cells have to divide so that you look as beautiful as you are. Your cells divide for your hair to grow, for your nails to grow, for your skin to, change. Because if you have the same dead skin every day, guess what? We're going to look awful, right? So cells divide. It's every bit of our body, cells divide. For some reason, and there are a number of different reasons, and I'm going to come back to that in a minute, the cells stop growing in the same pace. They start to grow too quickly. They start to overtake that area. And that's why cancer can occur in every part of your body. We have cancers of the eye, of the mouth, of the nose, of the throat, breast, and go down the body. Cancer can occur there. So there's no stigma about this. The person who got the cancer did not do any wrong. And there's nothing, no village people, sorry, okay? No, nothing like that. It's just something that has happened. And if we believe that everything that happens to us happens through God and from God, because a lot of cancer survivors and their families, they are changed by that journey, okay? They are totally changed by that journey, especially when they do well and they survive, which is hopefully why we're here at Marcelle Ruth in Lagos. And next slide, please. So why do people sometimes get cancers? Do you know, for a lot of patients, sometimes we don't know. Sometimes we cannot find the answer to the story. But the biggest things that we know about are sometimes our lifestyle habits. So for the people in the room that might, I'm sure nobody here smokes, has never smoked in their lives, right? Okay, smoking is a no-no. And for some reason, in particular in women, so if men smoke for 10 years and a woman smokes for the same 10 years, the effect of the nicotine in the lungs of women is worse than the effect of nicotine in men. And when men stop smoking, after 5 years, they almost go back to being non-smokers. But for women, that effect lasts for another 10, 15 years, right? Yes, true fact. So do not smoke, drink alcohol in moderation, eat in moderation, all right? Being overweight is a risk factor for cancer, as it's a risk factor for hypertension and for diabetes. So actually, wake up now. You know, I said you could go to sleep. Maybe you shouldn't go to sleep. So hypertension, diabetes, they're called the metabolic syndrome, and cancers, the risk factors are almost the same. So please keep your weight down. I like the double wrapper and tying it at your waist. That shows you where you're standing, right? And so on. So, and also, you need to move. When I was watching the choir this morning, I was thinking to myself, because at the moment I'm on a challenge. In February, I was in a challenge with a group of women. We walked 100 kilometers through the month of February. So it's a WhatsApp group. All you have to do is walk, and then you record the number of kilometers you walked every day. You post it on the group, and you know, when you get 100 kilometers, you can stop or you can continue. So it's to encourage one another. And then, can you imagine, they were so cheeky, because they said the senior citizens in the group seem to have finished this walk before us. Those of us over 60, can you imagine? Senior citizens, I don't know about that. But anyway, also post-COVID, we now realize that our mental well-being does not mean, am I mad? You know, the way we use it, right? That's not what we mean. How are you in yourself? And I think that's what this last few days has done. How amazing is that? To teach women that actually we need to be well. We need to look after our well-being. We need to look after our souls. We need to look after how we feel within ourselves, because that reduces our levels of stress. And if your levels of stress are lower, you're not likely to be overweight, because you can cope with the kind of food you're supposed to eat and so on and so forth. All right? So there's some things that we can do something about, some of the risk factors of cancer. Smoking, alcohol, eating well, sleeping well, and reducing our stress levels, and being supportive of one another, which you obviously do here at church. Next slide, please. And I think I've said that already, but there are other things. So there are infections that can occur in the body that most of the time we're not aware of. There's something called H. pylori, Helicobacter pylori, which sits in the gut, right? And sometimes it's from when they're children that they have this bacteria. Sometimes it can cause heartburn, and you might go to the doctor. Sometimes it may not do anything at all. And that's why the other big message I want to give is, particularly for those of you in the room who are above 40, 45. There are not many of you in the room that are above 40, 45, right? You're a very young church. I could see by the people dancing on the stage this morning. But anybody who's above 40, 45, the annual wellness check. And so to Pastor Sarah's story, yes, I don't want you to come to me when you're unwell. I want you to come to me, to come and do your annual wellness check. so that we can check all these things. Because you will not normally know about checking H. pylori or anything like that, right? But we, the experts, know what we should look for, what are the risk factors, and to tell you, because it's easily treatable by antibiotics, a combination of antibiotics and omeprazole, and we can eradicate it. But then you have to check that it's gone. So that's one risk factor, but it's a risk factor for stomach cancer. So if you don't know that you're carrying it, and you carry it for many years, it changes the division of those cells, do you remember? To speed up their growth in the stomach area, and is a risk factor for stomach cancer. Okay? Same way, the human papilloma virus. Now, I'm sure a lot of you must have heard about HPV, because there's a lot in the country right now about vaccinating your daughters. Okay? Because again, it's a virus that can occur in the private parts, let's say that. We're all adults here, right? Even though we're young, we're all adults. But again, it can be transmitted when people become sexually active, and not because there's anything wrong with what they're doing, even when they get married. So, but if we vaccinate our girls after the age of 9 years old, and even now our boys, for example, we can take away this virus. And in fact, most places in the world, cervical cancer is completely eliminated. And it's, yes, true, from those vaccines. So please, as a responsible church, I want to actually appeal to you. These are the kind of stories that we need to carry. We need to prevent. We need to stop the things that cause cancer. So we don't smoke, we don't drink alcohol, we eat healthily. We can control those. But we don't know if we're carrying HPV, all right? But if we vaccinate our girls, there'll be no HPV. After a while, in the whole country, there'll be no human papilloma virus. And that's why I'm actually in Abuja, because I was appointed to sit on a 15-man task force to think about how we can eradicate cervical cancer in Nigeria. Okay? Yeah, thank you. So please, for those of you who have not heard of it before, or who have heard of it before and said, I don't want any vaccine for my child, you're not actually doing your children a favor. And the vaccines are safe. Take it from me. We've used these vaccines now for years, and we're eradicating cervical cancer. The issue we have in the country, and I was saying this to Pastor Sarah, is that we don't have a structured, regulated primary health service. Because everyone in this room should have a doctor, their own primary family doctor, right? Not privately. I mean, the country should have doctors that work, that you can just go and see when you have a problem. And that's the reason why cancers present late in our part of the world. It's not just Nigeria, most of Africa and most of Asia. Because the countries have either not invested in or don't have the money to put into place these primary health services, so that when people are unwell, they immediately go to their doctor and the doctor sees them. But you know something? Just as was said earlier this morning, we need to take control of our lives, right? Okay, they've not done their job. Hopefully they'll get there one day, okay? In the meantime, please, if you have any problems, and I'll talk to you very quickly about the kind of things, if I've got this, should I go and see a doctor? Or if my child has got this, should we go and see a doctor? All right? So public health programs through churches, right, is important. So what we're doing here today, it's of God. Because if I hadn't asked to speak to Pastor Sarah, because I was so upset by that patient's story, I wouldn't be here this morning, right? But in that one conversation, we clicked, and she was excited, I was excited, and I said, oh my gosh, actually I'm coming to Abuja for International Women's Day. And she said, we have a program. I mean, how? If that wasn't of God, church. If that wasn't of God, right? Okay, next slide, please. And this is what I'm saying about HPV. If we vaccinate 90% of our girls before the age of 15, if we screen at least 70% of our women for this HPV, then 90% of the women will only present, will not even have any cervical cancer at all, and we'll be able to eradicate it. And this is WHO's hopeful thinking to put all these programs in place so that by 2030, there will be no cervical cancer anywhere in the world. Amen. Amen to that, right? Next slide. Good. So, you know, when I give these talks, people say to me, oh my gosh, is this cancer? Is it that it's getting worse? I mean, why are the numbers climbing? But, you know, one thing is there has always been cancer. There has always been. And I think that there probably always will be. But what we want to do is change the story, like I said, to people presenting earlier. But in as much as we are all worried about cancer, if you look at the data in 2020, all right, COVID-19 killed 3 million people, about, that we think, in the world. And look at how worried all of us were about COVID-19. In that same year, cancer killed 10 million people. That's how common cancer is, okay? But my message to you this morning is, if we can pick it up early, if we can pick up the signs early, and we can start treating people early, and they stay with the treatment, because that's the other problem we have. We start treating people, and next thing they disappear, because they've gone to church or wherever else, and so on. And then they come back when it's already really advanced, and we can't do anything about it. Breast cancer is the commonest cancer in women. Prostate cancer is the commonest cancer in men. Cancer in the gut, in the colon, is the commonest amongst the two sexes. And then there are other cancers. And they are cancers that are more common in different parts of the world. So lung cancers in Europe and America, because they smoke quite a lot. We don't have that many lung cancers here, although we are beginning to see a few more cancers. I have my theory about generators, but you didn't hear me. Next slide, please. You didn't hear me say that. Okay, because we have no choice, right? I don't know about you. Eco disco, or the electricity disco, when my hospital electricity bills were 3 million naira until they started doing band A, did they do that in Abuja? Yes, and we're now paying 20-something million overnight, right? Okay, but anyway, you come here to complain. There was something this morning about we're not complaining. We're not complaining. Look at those yellow gillies, people, and the white gillies. We're not complaining. All right. What is it that should tell me that I might have a problem? I must go to hospital. I must see a doctor. I must make sure that I go and check myself out. If you have any lump anywhere, any lump of any sort, that is still there, for me, 3 weeks later, that's all you have, 3 weeks. After 3 weeks, please go and see your doctor. I don't mean Dr. Google. Are you hearing me? Are you hearing me? Because I have people that come to me and say, but you see, I read it on Google, and Google said that I should now do this, and I should rub it with, Okay? There's a reason why quite a lot of us had the honor and the privilege to go to medical school, right? Please, if you have a lump or a swelling that's still there after 3 weeks, something that looks like a wound that still will not heal after you put whatever it is that you normally rub on your wounds, including rub. I don't know how many people grew up with rub. I grew up with rub, showing my age, right? Okay? A cough that doesn't go away after 2 weeks, especially if you've been given antibiotics, 1 course, 2 courses, please go and see your doctor, all right? If you lose a lot of weight, and not because you were trying to lose weight, and even if you're trying to lose weight, but the weight is just going off much quicker than you have, right? Please go and check out with your doctor. Any abnormal bleeding from anywhere. So for example, one of the patients I admitted this week was an 82-year-old lady who went to the bank to collect her foreign exchange, wanted to go on holiday with her grandchildren, and stood in the bank, and she started bleeding from below. Standing in a pool of blood. Okay. Yes, she came and she has endometrial cancer, cancer of the womb. But guess what? Stage 1, hasn't gone anywhere. We took out the womb. I mean, what does an 80-something-year-old woman want to do with a womb? Right? Okay? And she's fine. Absolutely fine. The problem is, thank you, if she hadn't done anything about it, or she'd gone to see the wrong people or whatever else, and she's coming another 4-6 weeks later, it has now gone to the lungs, the liver, the this, the that. There's nothing we can do. All right? So please, all these things you can read here, 3 weeks maximum, maybe for 1 month, make sure you go and see your doctor, okay? All right, next slide. And so this is just a picture to show exactly what I've just been saying, especially, okay, please back up, please. Yes, Pastor Sarah has it. Change in skin color, the nipple discharge. Actually, for colon cancer, is if you suddenly develop diarrhea or constipation. Okay? Now, one thing I found since I came back to Nigeria, a lot of people are very, very concerned about how many times they move their bowels. I don't understand. We seem to have a real thing. I haven't gone for 1 or 2 days. It's like a problem. If you haven't been eating it depends on how much you've eaten. It depends on what type of food you've been eating, right? Sometimes you don't go. But if you have a complete change in your bowel habits, if you suddenly get diarrhea or constipation, please, and especially when that is combined with weight loss. For men, prostate cancer, sorry, I was doing International Women's Day. I came in my populo. You didn't even clap for me. Shall I just go back to Lagos now? Right? At least I came in purple. She didn't tell me anything about color. If she said, I would have maybe half purple, half yellow, or half white. All right? For men, prostate cancer, typically the way it presents is that men, when they want to pass urine, because the prostate is around where the end of the bladder is and the urethra starts. So they suddenly find that the urine is not just coming as it was before. They have to stand there. It's called hesitancy. And even when it starts to come, it's like dribbling out. Okay? Those are the two things, prostate. And sometimes it doesn't mean it's cancer. It might just mean that the prostate is enlarged. And enlarged prostate does not necessarily mean it's cancer. So again, that's why you have to go to the doctor. Okay? So what else can I think of? I think those are the main things. But yellowness of eyes, jaundice, and then nipple discharge, but that's on the next slide. Yeah? Okay? Are you with me? All right. So for breasts, because we're talking about women, and just to finish off how many days of looking after women, any lumps anywhere around the breast, and you should check your breast, by the way, self-breast examination every month. And for those of you who are still having your periods, around the time of your periods, every month in the shower, your hand behind and then with the other arm, checking all around. And then the other way. And once you start doing it on a regular basis, you'll begin to feel the changes. Okay? So self-breast examination every month, once a month, is absolutely important. And if you feel anything different, sometimes it's the husbands that find the lump. Okay? I think that's great. Okay? A man will save his wife's life. No? A man will save. And it happens often. Yes, we get it. Yes, it's a husband that says, I felt something or whatever. Please still take it seriously. And please still have it checked out by a doctor. Discharge around the nipple when you're not breastfeeding. Just sort of funny feeling around your breast. When the nipple goes in or comes out more than it was before. Color changes around your breast. Pain anywhere in the breast or around the nipple. Changes in the texture of the skin. It's called tethering. Any lymph nodes, so up here in your armpit, feeling any lumps or bumps in your armpit that you didn't feel before. Again, and then and swelling of the breast that wasn't there before. Okay, all these things, please, just keep an eye on it for 1, 2, maybe 3 weeks. After 3 weeks, what are you going to do? What are you going to do after 3 weeks? You go to the doctor. And not doctor. No, okay, all right, next slide, please. Okay, so this is an important slide. This is an important slide. And this speaks to the message I'm trying to give this morning. Cancer will always occur. There are risk factors for cancer that we have no control over. We have control over not smoking, not drinking alcohol, and so on and so forth. We don't have control over needing to use generators, do we? Right? Or smoke that comes out of car, what do you call them? Exhaust pipes and so on. But other things, and we don't have control of not knowing that we're carrying a bacteria in our gut or a virus in that part and so on. What we have control over is when we pick something up and go to the doctor. And this slide just exactly illustrates that. If you look at the first bit, is 0, there's no abnormal cells. 1, the cells are beginning to grow too fast, which is when you're going to pick it up because you felt this new lump and so on. Look at the bottom brown bit. If you come in stage 1, you have a 98% chance of being cured. Being cured, 98%. I'm using breast to illustrate this, but it's the same for prostate. If you go at the time when that dribbling and everything just started, or you saw blood in your urine, that's another one, blood in your urine. Blood anywhere, it was not supposed to be. That's stage 1. Your chances of being cured are 98%. Okay? Once the cancer starts to move outside that area, that organ, we're using the breast here, that's number 2, into the lymph nodes around you, the survival drops to 80-ish%. Once it starts to go out of that organ to the lungs, the liver, look at how much the survival rate drops. Does that make sense to you? Yes? From 98%, the same person coming early, to only 18% or 16% when it has spread. And please, that is a message I want you to carry from here this morning. And that's why you have to encourage people. Don't say, hey, you think it's, no, it's not your portion. Blood of Jesus. Yes, we understand all that. Yes, we understand. You know something? Instead, you say, you know something? One doctor said to me, this thing is curable. Oh. It's curable. Go and see your doctor. And then you phone them. You phone them, because if you didn't learn anything else this last 5 days, I'm sure one thing you learned about, especially the women in the room, is that we need to, and for International Women's Day this year, that we accelerate action. We don't just speak. We pick up the phone. How are you? You told me that you saw that lump in your breast. Have you gone to see the doctor? Please, go and see your doctor. Right? Okay, next slide, please. Okay, and the possibilities of treatment are many. Most cancer patients need surgery to remove that organ where that lump was, or the mass. Sometimes you don't have to remove the whole thing. If it's just a lump and they come at stage 1, we'll just take out the lump. We don't take out the whole breast. There are reasons why we might want to take out the whole breast. And the same with prostate. There's surgery, there's chemotherapy, there's radiation therapy, there's new targeted treatments where we use drugs that actually work just on those cells in that organ. They're very, very efficient, but they reduce the side effects. These treatments are now all available here in Nigeria. Okay? They're all available now in Nigeria. I left my 30-something years of career in the UK, all right, and moved back to Nigeria 5 years ago to set up Marcelle Ruth. I'm extremely grateful to God for the privilege, for saying to me and my husband, go and do this. And also for making it possible to do it. Because nothing is easy. For all of you who run businesses in Nigeria, including, I'm sure, this church, there's nothing that's easy to run in this country, right? So when God gives you the opportunity, look at your church. This is God. This is of God. Right? There's nobody here that can sit here and say, I did this by myself. Nobody. Right? So all these treatments are now available. Next slide, please. And so we're not going to complain, but I've said that this education and awareness, which, okay, I'm giving now as a professional, but you will give when a work colleague says to you, oh my gosh, I've lost so much weight, I don't know what's wrong with you. My dear, please, go and check. Or one of your male colleagues at work, in the cubicle next door, you can see that that urine is not coming out. When he comes out, mister, is there any problem? Maybe just quickly go and check. Do you understand? That's our job from this morning onwards. And for those who come to you and say, I have a colleague who has cancer, we have no money, blah, blah, please support them. Please support them. Nigeria is not easy. If we had hospitals that were government-owned that we could go and have care, we'll go and have care. For all those of us who are running it in the private sector, it's very expensive to run anything in the private sector. So treatment is expensive. But let me tell you also, treatment is expensive everywhere in the world. Okay? So it's not as if it's not just here. Next slide, please. And we lack a lot of the things that we need to treat patients. So radiotherapy machines, for example, there are only about 10 in the country. There should be at least 1,000. You should have one of these radiotherapy machines to 100,000 of the population. We have 200 million people. Let's say I was never good at maths, because if I was good at maths, I would have gone into banking, finance. Do you understand? Like my brother and my younger sister, but maths was not my thing. So medicine, it had to be. But I'm very grateful to God. But we should have at least 1,000 of these machines in this country. Today, in 2025, today in Nigeria, we have 10 machines. And about half of them, including the 2 in National Hospital Abuja, are not working. Because they can't afford to pay the maintenance contract. All right? Yes. I know you're saying, hey, but take a trip to National Hospital Abuja one day. Because I did. Because I sit on another task force where we're looking at cancer control. The queue around the clinics, like this. So, but we will have to push the government. We have no choice because these machines are very expensive. We do have one at Marcelle Ruth. Next slide, please. Amen. So came back after 30 odd years of doing lots of things in the UK and being very, very privileged to end up doing, clinical work, research, and so on. I was a consultant in 2 teaching hospitals in the UK. My last job was at King's College Hospital, where I went to set up a center for the Department of Health. And one morning, I woke up and I thought, something? There's something very bit funny here. I go to international conferences and I stand on the stage and I'm very proud of myself because I'm the one black woman, right? Not just man, woman in the room, talking about all these incredible things that I've done and everybody's hailing me. And I thought, one day I said, and what's happening in Nigeria, my country, where I went to medical school? I didn't go to medical school abroad. I went to medical school at Lagos University Teaching Hospital. I'm thinking to myself, excuse me, what's your purpose in life? God has given you all these opportunities. What is your purpose? To stand up and say, I'm really, really, because I had the opportunity. Both my parents were professors of medicine, by the way. So, yeah, exactly. It wasn't like I'd done something extraordinary in our house, to be fair, But it just occurred to me, and I started praying about it. I journal. I don't know how many of you journal. Because when people ask me, when was the first time you thought about doing this? It was in 2012. And every time I used to say, but Lord, don't let this happen unless my husband wants to go back to live in Nigeria too. Because he had no plans to come in to live in Nigeria. Long story, there's Marcelle Ruth, okay? And it's named after his mom, by the way, his mother, who we lost from complications of breast cancer. My mother-in-law, one of the most incredible women, who as a young white English woman came to live in Nigeria. We don't know why, because she didn't come with a church or anything, but she came to live in Nigeria. And she ended up being a teacher in Queen's School, Ibadan. Then she taught history in Igobi College. Then she became the deputy headmaster or whatever in Igobi College, Lagos. And later on, she became the first principal of government college in Janiki when the government set up the government colleges. She was the first principal. That was who she was, an English white woman who brought up 4 children in Nigeria, who when I met my husband when I was 5 in primary school. Different story altogether. But later on, when he was doing shakara, men, and I was waiting, thinking, are we going to marry or what is all this one? I'm following you everywhere. She called me one day. She said, you're still following him. She said, you know something? Let me tell you what to do. Go to him and say, in 6 months' time. In fact, I have some other guy that's waiting. So I give you 6 months. If you are not ready, it's okay. Just 6 months. But it's all right. And go. After 1 month, I got my ring. Hallelujah. But he has been my most amazing partner. He's not a doctor. He has funded Marcelle Ruth Hospital in Lagos, where we brought the first true beam, the top of the range radiotherapy machine to Nigeria. Can you help me pray for him and thank him when you're thinking later on tonight? Next slide, please. Yeah. This is what we look like. When you come to Marcelle Ruth, none of it was by mistake. Everything was intentional. Light, color. A place where people come. And we don't just treat cancer patients, by the way. A place where that's why we call it a specialist hospital. A place where people come with hope that they're going to get better, that they're going to be healed. That's who we are. Next slide, please. And we are in 3 buildings in the end of a close in Victoria Island. Next slide. And like I said, that's our day unit. Purple was my mother-in-law's favorite color. So we have purple. Next slide. And we have a 3D mammogram. And if you're going to have your mammogram, please, all the women in this room who are above the age of 50, if you haven't had your mammo, please, I beg you. I'm begging you. Annual wellness check. Next slide. Okay. Theaters, one dedicated to the memory of my father, who was professor of cardiothoracic surgery and started the Lagoon Hospitals in Lagos. Next slide. And the True Beam machine that I've told you about, which has been functioning since May 2021. Next slide, please. We've grown from 6 members of staff to almost 90. Next slide. Yes. We have treated almost 5,000 patients at Marcelle Ruth, including about 200 children. Next slide. We treat leukemia, lymphoma, and so on. And this is just to show you that this is our own data of patients who've come to our hospital. Of those who presented early, we've only lost 2%. Yes, but of those who presented late, of course, we've lost the majority of them. So I'm sure my message is clear from my experience here in Nigeria. Next slide. Okay, so early detection, ladies and gentlemen, saves lives. Saves lives. Cancer is curable. Please see your doctor if you have any problems. And when they determine your treatment, stay with the treatment. But also come to church. You can see who I am here. A committed Christian who knows that I'm only doing what I'm doing by the grace of God. So that's the message also, because people think, it's only if I'm at church. No, we do the two in parallel. Because we too, we're praying. We're praying for the successes. We're supporting as we go along. Next slide. And this is just a leaflet. Keep going, because I'm going to run out of time. But I wanted to make this point. So we do a lot of education and awareness programs, particularly around Breast Cancer Day in October, okay? And this was one that we collected some data. We gave questionnaires. We had over 200 people. We had to stop we did it online. After 12 hours, we had to stop the people coming in because we had too many. And we didn't have enough. We only have 1 mammogram and 2 ultrasound machines. And we did this questionnaire. And the majority of the women were over the age of 40, which is what we want, that came for the program. But about 60% of them had never, ever had a mammo. Had never had an annual wellness check. I need you to help me change that story. Okay, next slide. So annual wellness checks, some of you, they offer it to you through work, some of you, whatever. You know, when we say, it's too expensive, think about all the things that we buy. That car, that house, that bag. You know, we can't use any of them if we're unwell. Right? I hope that message is clear. All the things that we're chasing with all the money that we have, none of it. They say health is truly wealth. Because without your health, you can't do anything without wealth. Next slide, please. So just do it. And in the logo of Nike, right? Just what? Just don't. I do it around the time of my birthday. Because to me, that's the day God created me. So around the time of my birthday, I plan my wellness check. Next slide, please. And this was a walk that we did. We always celebrate World Cancer Day, which is February 4th every year. And we do a walk with Marcelle Ruth. And this year, it was amazing. The theme was united in our message, but unique in our stories. So every cancer patient has a different story. But they're united in that one message. And if you look at the pictures there, Farouk Oreagba on the left-hand side, they now call him Mr. Steez, is a 15-year cancer survivor, right, under my care. And then Tinu Lawal, who is now the president of the Nigerian Cancer Society in Lagos State, she's a 30, 40-year survival. Chifomik Akibogun, again, he developed painting through his cancer journey. And he has painted some amazing paintings and has given it to us in the hospital. And the lady on the end, Miriam, was currently going through her treatment at the time. And I will quickly share her story. I know my time is up. Because I remember on the ward round, she said to me, oh my gosh, I'm a geophysicist, and I think I'm going to lose my job. And I said, look, sit down. Here at Marcelle Ruth, where everybody has to continue their lifestyle through their treatment. So we expect you to show up the way you're showing up. We expect you to still go to those parties. Just stop by on your way. It's our job to make sure you don't throw up, you're not sick, and so on. And actually, those things don't happen anymore because we have powerful drugs. Yes, we do. No, nobody, if we come to the hospital and you have to have chemotherapy and you vomit, we are failed. But we will get another drug. All these things. We put something called a Porter cath in. People have all their infusions. We're not looking for veins and struggling all over the place. The treatment has changed completely. Totally. Totally. When you come on the day of the walk and the thing afterwards, people don't know who has cancer and is having treatment or who just came to visit or who just came to whatever. True story. Because people will say, oh my gosh, I didn't even know that she was affected. So this lady, because we encourage patients work. They go to work, they do all the things they're meant to do through their treatment. Yes, some days they will feel tired and whatever, that's fine. But most of the time, they're doing what they're meant to do. All right? And so we got her a specialized computer that she needed from her office so she could carry on her work. And I think that's my last slide. Yes, I got there. Just with 1 minute to spare. Thank you so much. I am so grateful for this opportunity. Thank you so much. Thank you.
You are not clapping like you should. Please be seated. Was it worth it? Yes. I'm just tired of cancer in Family Worship Center. Our pastor, my husband, died of brain tumor, and a lot of times they come to us, they need money. Yes. We have spent thousands of millions helping people. Oh God, help me to remember everything I wanted to remember. Did you say H. pylori or whatever? H.
pylori.
Is that a H?
They were listening. H. pylori.
I was diagnosed of it too.
Yes, you've had your treatment.
I've had the treatment, but I've not gone to check if it has gone.
You have to check. No, you'll be fine. You'll be fine. You'll be fine. We're in church. You'll be fine. Hallelujah. You'll be absolutely fine. You'll be fine.
There's something important. You know what? Why I looked for you in my spirit was when Pastor Inadem were doing cancer and cancer treatment. The chemo will make them. My husband took one. He said, "Honey, if this is the only medicine, let me die." Because he will throw up through the night, he will stool and all. But then one of my friends or daughters went to Marcelle Ruth and came back. She will go and do cancer treatment. She will come back and be doing gardening. She is all over the place. She said, no, there are no side effects. And then recently, somebody in church got cancer. And they are telling me that the first treatment she got, the one that came, that connected us now, she said every day she does the chemo, it's like the saw, you know, this saw they use in the carpenter shop, that as if they are cutting her bones with. I said, no, in that hospital that this person went, there is no more pain. The chemo is different. All that vomiting and going through hell does not happen in that hospital. And she went. Yesterday, I asked her, how are you doing? She said, there's nothing. Once in a while, she just feel tired. And she has a little insomnia. I said, it's the insomnia, me and you. That's why we're texting at 1 o'clock. You know. So I'm just so grateful that we don't have to be afraid. Early detection is, may you not be in this church and get a lump and come to church and be praying and binding it. Pray and bind, but go to the hospital. That's what we have had, isn't it? You've been such a blessing. I don't even know how to thank you. And did you hear something when she started? What did you hear? She said, those of us, you people were listening, she said, those of us who are over 60. How can you say you're over 60? How can you say you and me are age mates? It's not even, that won't happen.
Jeans, my mother is 91 and she looks like she's about 70.
It's jeans, but so I should not be angry with you.
No, don't be angry.
Because I'm like, why is my thing coming and here is tatara? You know tatara on the neck. Like, seriously, no, this can't be real. But jeans, you look fantastic. And you did a fantastic job.
100 kilometers in February. All of you, you need to move. We need to move. The people that are dancing this morning, join the choir. Come on, move.